being first-time parents, we had no idea what was going on and what to expect really. So it's just very scary.
NETS is the emergency transport service for newborns, children and infants.
When a child is critically ill or injured across anywhere in New South Wales, the clinicians on the ground call NETS.
Hazel had been asleep for about an hour or two, and I had realised while she was sleeping her respiratory rate was going up.
And then when her work of breathing increased, she thought, right, I better go and just get reviewed in the hospitals. The clinicians on the ground there cared for her for up to 48 hours, but she was not getting better. So that's when they rang NETS, and as soon as the NETS consultant started listening to the story, they dialed it into the camera and were able to see her on the camera, and she was indeed working very hard to breathe.
NETS were monitoring her and they realised that she wasn't getting any better, she was getting worse.
They do say a picture is worth 1,000 words, and it's never been so true when you're trying to judge what will work for a sick patient over the telephone.
So it's in real time, like talking on a phone and saying, you know, Hazel's breathing is a bit funny, her respiratory rate is this, is very different to them looking in a camera
and seeing it.
And just seeing it.
We get a bird's eye view of the patient, their surroundings, the care they're receiving, the monitoring and the equipment.
While the retrieval team was travelling towards Hazel, they linked in with clinicians in the Sydney Children's Hospital Network Paediatric Intensive Care Unit who could also see Hazel, and they were able to assist the local team on the ground with providing extra respiratory support.
They're not sort of wasting time observing her because they know what they're coming into and they know what needs to be ready.
A retrieval team arrived at the bedside with Hazel, and they were able to continue her respiratory support and admit her into a Children's Hospital Intensive Care Unit for the next few days.
A massive thank you really to everyone involved. Yes, they're helping her, but it's also they've been very caring towards us as well. Like the whole experience, all the staff are very empathetic and check in with us throughout the whole process of how we're feeling while she's, you know, not in the best state.
Part of my mantra at working at NETS is keeping childhoods on track, and it is always really rewarding seeing the children come back and seeing them happy and healthy and, you know, continuing their childhood as they're supposed to.
Very reassuring to get that level of help, and as you can see, she's much healthier and better today.
We're really thrilled, and it's been a great journey working with eHealth.